Hello, everybody. So, we are from MOM IVF. Here's Dr. Poornima Durga, Medical Director, Chief Fertility Consultant at MOM IVF. And she's a Joint Secretary at OGSH, Hyderabad. Also, a certified teaching faculty for fellowship and infertility courses. A combined, combined with IMA basically. So, I'm handovering the webinar to Dr. Poornima Durga, and she'll continue.
Yeah, thank you so much. Good evening, everyone. I'm very happy to see good number of attendees for this webinar, which is such an unusual topic about sexual and reproductive wellness, which is the most ignored aspect, which we don't talk about, the most taboo topic. And I'm very happy to see quite a number of people who have joined for today's webinar. I've seen some doctors also joining in some, so very happy to see that. So I'll try to give a overview of what is sexual and reproductive wellness. If you have any doubts, you please can type in the chat box. We'll address at the end of the session. Thank you so much for again joining this webinar, and I'm going to continue. Yeah. Is my screen visible to all? Yes or no? Anybody can just... Yes? Okay. Thank you so much. Thank you. Yeah. So, once again, I'm Dr. Poornima Durga. I'm the Chief Fertility Consultant at MOM IVF, Medipatnam, Hyderabad. We have been doing the sexual reproductive health awareness programs for the past 3 years or so, where we have educated a lot of people, young adolescent boys and girls, and we went to slums where we spoke about safe sexual practices, where we have come across early pregnancies like teenage pregnancies and unwanted abortions and all, which have led to pelvic inflammatory diseases, PIDs and all. So we went there and educated about them about safe sexual practices. So for the past 3 years, we are doing these awareness programs. So hope to continue the same in the future years as well. And it's always at MOM IVF we integrate sexual health as a part of fertility health. It's very important to integrate both together. And this year we are looking for more for a preserving fertility rather than treating fertility, where we are talking about fertility preservation methods and about how to prevent sexually transmitted diseases, sexually transmitted infections. We spoke about, we want to talk about HPV vaccination, which is one of the preventive aspects, and one of the preventable cancers is cervical cancer, which can be prevented by HPV vaccination. So these are all few agendas for this year, coming year from MOM IVF. So why this topic matters so much? Why we have to talk about this? Being a gynecologist, it's not my duty just to treat or give some ovulation induction drugs or try ask them to have timed intercourse or something. It's my duty as a fertility specialist to dig into their history, talk about their to talk about their sexual practices and any sexual dysfunctions. When I spoke with them in detail, I have done a psychosexual counseling course from JSS Medical College from Mysore, where I was so surprised to see so many sexual issues both in men and women, and also there were so many sexual behaviors in the people. So then I came to know that how important it is for me to integrate psychosexual counseling in my fertility practice. So when it comes to the, see, it's a very less talked about topic, but when you look at it, when I started getting interest in this topic, or when I got trained in this topic, then I understood the importance of taking a proper history. So when I took a proper history. When I actually, generally what we do as a fertility specialist or gynecologist, when we ask the people to have timed intercourse, when we say that you have ovulation and you just have intercourse, we tell them to have timed intercourse and leave them, but we really don't know the actual issues what the patients are facing. And then a lot of patients have come to me and told that, especially the men, women, they have, see, for men it's not a physical act, it's a mental act as well. So men has to be relaxed to have proper erection and to have proper intercourse. But when I spoke with a lot of people came to me and said that it is becoming very taxing to have intercourse at the time of ovulation. And also there are so many myths around how many times you should have intercourse during the time of ovulation for pregnancy. So let's bust some myths and facts about sexual dysfunctions today's webinar, and also let's also understand about little bit of menstrual and sexual hygiene. So as I told you, why this topic matters, because reproductive health affects individuals, not only individuals, families, and not only families, and also society. So it's a very important topic to be spoken about. Lack of awareness leads to preventable infertility and disease. Because of the lack of awareness, a lot of people don't know what to do, how to do, when to do, and how to manage their lifestyle. There's so many things people don't have awareness about, because this is a topic which a lot of people doesn't want to talk about. So because of this, there are a lot of infertility which can be prevented by simple, see, some cases needs fertility treatment, but some cases just need simple counseling and awareness about the process, and about their own sexual, or understanding their own reproductive system is very very important, which can give them normal pregnancies. Early education definitely empowers better life choices. That healthy reproductive years means healthier future generations. Yes, right. So, what is sexual and reproductive health? According to WHO, the World Health Organization, it is a state of physical, emotional, mental, and social well-being in relation to sexuality and reproduction. It's not just about your physical health. It is about your emotional health and also your social well-being. How good with you are with the society, or are you feeling lonely, or you feeling socially awkward. So there is mental, whether you are having anxiety, depression, for the performance of sexual act. There's a lot of things which goes in. It should be a holistic approach. So everything should be fine to have a proper sexual and reproductive health. It's not just absence of disease. The first important thing is you should understand puberty, especially adolescent boys and girls who are just entering into puberty. If they are not having awareness what it is, they have a lot of myths and taboos and lot of inhibitions to talk about. So it's very, very important. We went to so many schools and colleges to talk about understanding puberty. First, you should know your own body. That's very, very important. You should know your organs. You should know your body. Then only you feel more confident, and you can able to able to transit this pubertal phase, especially for the young boys and girls. Lot of girls doesn't know how to handle their periods. Lot of girls doesn't know how to look at the hormonal changes. People are especially young girls, when they went to school, they're so embraced because of the axillary hair or pubic hair. They're not comfortable with the breast changes. So there are a lot of inhibitions in boys and especially boys. Boys also, they have a lot of inhibitions about their voice change, acne. So there are a lot of inhibitions in the young boys and girls. So understanding puberty is very very important. Educating them at right age is a very 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 important. It's of utmost important subject to be taught about. So it's very important to have open conversations in schools about these topics, especially when it comes to girls. There will be change in the breast development, body changes, as I told you, pubic hair, axillary hair, and a lot of people have acne. So menstrual cycles, how to manage their menstrual cycles. A lot of people, young girls, don't know how frequently they have to change their menstrual pads, how to dispose of the menstrual pads. These are all very important things which has to be taught in school. And when it comes to boys, it's about voice change, facial hair, and testicular growth. So these are the things they should understand their body, they should understand the changes which happen in puberty, so that they don't feel socially awkward and they could embrace the changes, and the transition happens smoothly during puberty. When it comes to menstrual health, we all know that the normal menstrual cycle is 21 to 35 days. The period duration is 2 to 7 days. Anything less than this or more than that is abnormal. If you have heavy bleeding, more than 7 days with clots or with severe pain, abdomen, severe pain is not normal. Mild pain during periods is normal, but severe pain is not normal. So these are the things, these are the situations where you need to consult the doctor. Excess bleeding definitely requires medical consultation. Whenever it is deviating from the normal, it is a time you have to consult the doctor. And we all know that the first 1 or 2 years after the first period of the female, of the girls, the periods might be irregular. It takes 1 or 2 years for the HPO axis to settle and have proper regular cycles. So there is no need to panic if the cycles are irregular in the first few years after the period. A lot of parents come to me with their children. The periods are they just attend menarche, and if they didn't get the first period properly, the next period is delayed, they have become anxious and come to us for treatments, where we need to counsel them that it's a normal process. It takes 1 or 2 years for the HPO axis to settle and get her normal menstrual cycles. So it's very important to break the stigma and say that. And also there is a lot of myth that periods are not healthy. There are a lot of social taboos which happens during the menstrual periods. It's very important to break the stigma and say that periods are healthy. Menstrual hygiene, very important. If not maintained properly, leads to a lot of pelvic inflammatory diseases, and also urinary tract infections are most common if you don't maintain proper hygiene. So menstrual cycle, the most important issue and least talked about. And so let's bust some menstrual myths today. So generally, when you look at the myths, beliefs, and taboos, there are some harmful restrictions. Like during menstrual cycle, they shouldn't touch anybody. They shouldn't bath or touch a cow, look into the mirror, touch a plant. In my childhood, in myself, I used to, my mom used to tell me that don't touch the tulasi plant, it will dry off when you are in period. So these are small things which we had during our childhood as well. So these are harmful restrictions, but the relieving restrictions are, people used to get the women used to get rest during their menstrual periods in the olden age. Like previously, women may appreciate the banishment to menstrual health as they're given rest period from the normal intensity of daily course. But now with our busy schedules, again we are working in and out. Women are working during the menstrual periods, and now there are a lot of companies who are giving a menstrual leave for their women employees, which is again a welcoming sign. So again, it is coming back to normal, where women are being given rest period during their menstrual periods. So the working women are getting some leaves during their periods. So these are some beliefs and myths and taboos during the menstrual period. Hygiene. What is hygiene? Hygiene refers to behaviors that can improve cleanliness and lead to good. Hygiene is a Greek word taken from the Greek goddess of health, cleanliness, and sanitation. Hygiene practices are employed as preventive measures to reduce the incidence and spread of disease for the preservation of health. These are preventive measures to reduce the incidence and spreading of the disease. So what all can happen if hygiene is not maintained? As I told you, during the period, especially during menstrual periods, the area around the genitals become moist. Wherever there is a moisture, there is a risk of infections if the area remains moist for too long. So it's very important to change your sanitary pads every 4 to 6 hours, so that the area doesn't become moist and you won't get infections. The infections can cause itching and irritation in the vagina. Due to these, dampness, rashes along the line of innerwear area are so common. Rashes, and especially women who are obese will have more severe rashes. I've seen women with obese having because of the moisture during the time of periods. If they are not maintaining proper hygiene, because of the rubbing of thighs, also there is a lot of itching and irritation and redness at the private parts. Menstrual hygiene is significant in ensuring that your everyday life does not get interrupted by menstruation, like school, work, daily activities. It's very important. Prevention of, as I told you earlier, prevention of possible urinary tract infections. It is most common thing. The vagina and the bladder will be very near to each other. So if you are not maintaining proper hygiene, there is a very high risk of urinary tract infections, which can, if not left untreated, can lead to kidney infections as well. So maintaining proper hygiene also ensures that you never run into potential situations of embarrassment, and hence makes you feel confident about yourself and your body. These are the most common signs and symptoms which you see in menstrual periods. 50% of the women will have mild menstrual pain, not severe. If you have severe menstrual pain, then it is very important to consult the doctor. Some people will have mild headaches because of the hormonal headaches. Some people will have excess heat, vomiting sensation, and mild pain. You can get them treated. If pain is very severe, you can consult the doctor. The doctor can give you antispasmodics. It's very important to maintain proper diet during these periods, not to eat spicy food, eat healthy food. Hot water baths, heating baths can also relieve the pain during menstrual periods. There are some, these are the yoga poses which can be helpful to relieve pain during your menstrual cycles. The menstrual cramps can be relieved by child pose and vajrasana. That's a very important and the best pose to relieve the tension on your stomach. Child pose is very helpful, and forward bend is also a very helpful yoga pose which can help to relieve your menstrual cramps. Yes, as I told you, these are the poses which you can try during your menstrual period. So, 5 things which everyone should know about menstrual hygiene. One is to choose the right sanitation method. When you look at the menstrual options we have, one we have is sanitary pads, we have tampons, and we have menstrual cup. Sanitary pads are easy, but it is very important to see which sanitary pads you are using, whether it contains plastic or not. As you know, plastic is the most common endocrine disruptor, and it has been linked to female cancers as well. So it is very important to see what type of sanitary pad you are using, whether it is containing plastic or not in that. So it's very important. And the other option we have is tampons. Tampons are also the same like sanitary pads, which has to be frequently changed. And the recent most important option which we have is menstrual cup. Menstrual cup is a very good option. It is reusable if used properly. It is very good alternate option, and for heavy bleeding also it's a very good option which you can use. And mostly it is made up of with latex, so rubber. Hygiene wise and also material wise also, it's a very good option which you can use is menstrual cup. So with so many, as I told, many different hygiene options available to choose from, we're absolutely spoiled for choice in the market. It recommended that you stick to a single brand and single method for some time to see if it suits your need as well. Especially young girls who are not married are not very comfortable with menstrual cup, even though they can use it, but still if they're not comfortable, the best option is to use sanitary pads which doesn't have plastic. So the second thing which we all should maintain is to remember to change every 4 to 6 hours in order to maintain vaginal hygiene. It is recommended that you change the menstrual pad every 4 to 6 hours. The blood released during periods is a blessed place for certain microbes and bacteria to flourish and multiply, increasing chance of vaginal infections or infections in the urinary tract. Women with heavy bleeding should change it more frequently. Sometimes if you don't change it and you leave, sometimes people leave the tampons inside. Pads at least we keep extra, but tampons are something which we keep inside. So if you leave it for a long time, very rare possibility there is a risk of toxic shock syndrome, which is very rare, which is very rare. The third important thing is I know a lot of young girls coming to me and asking me about what type of sanitation I have to use. Can I use V wash or any other external sanitizers around the vaginal area? So the most important, the best free resource that you can trust is always water. Wherever you are using these sanitizers or we wash or something like that, you are changing the pH of the vagina. Our vagina has acidic pH, so that it prevents, and we have a good bacteria which protects our, like how the army protects our country. The good bacteria, vaginal bacteria, that is called lactobacilli, which is lactobacilli predominant, it protects our vagina. It prevents the external other bacteria, harmful bacteria or disease causing bacteria to enter inside, so that, and it maintains the pH of the vagina. But when you use this external sanitizers or any other chemical on the private parts or on the vagina, it disharmonizes the pH balance, and it also disturbs the microbiome of the vagina. So there is a risk of, as I told, washing with soaps and all will kill the good bacteria. So, and it disturbs the microbiome, and there is a risk, increased chances of infections. So it's very important to trust water. Water is the best source. In order to stay safe and clean, trust water and nothing else. And also, one more important thing I want to mention here is, whenever you're washing your vagina or whenever you went to a stool, you're washing, it's very important not to, you have to wash from vagina to anus and not to inverse, else the bacteria from anus might cling to your vagina and couldn't get washed off, increasing chances of infection. It is always from front to back, not from back to front. And fourth important point is disinfect your innerwear in case of stain. So it's very important not to continue wearing the innerwear which is having stain. It has to be disinfected properly. Disposing of your pads properly, it's also a very important thing. Where you are disposing it, you have to dispose in a separate bin, and you have to keep the removed pad in a proper cover, seal it off and dispose it in a bin. So it's very important to dispose of used pad, as may the cause infection, create foul smell. Do not flush the pads down the commode, as you can clog the toilets. Wrap the used pad safely in a piece of paper before throwing it in the bin. Very important. Do not forget to wash your hands once you are disposed of the pad. So these are some important myths and facts about menstruation and menstrual hygiene. Coming back to reproductive health, fertility, being a fertility specialist, I'm seeing rapid decline in the egg and sperm counts of the couples. There is no specific reason. A lot of people come to me ask that why my sperm counts are coming down, why otherwise I'm sexually active. I don't have any sexual problem, or neither do I have diabetes or hypertension. A lot of females are coming up with low AMH. So when you go through the papers and all, then the most common finding which everyone is attributing to this unexplained infertility is lifestyle. So it's very important to have a healthy lifestyle. It's very important to have proper lifestyle choices. So female fertility starts declining after the age of 30, faster after 35, and more rapidly after 40 years of age. Especially the Asian women age faster. Reproductive aging is faster when compared to Western counterparts. So if you ask me, after being into fertility, I myself is promoting in my family to have at least one child before the age of 30. At least by 32 is something which I'm promoting it after seeing so many cases in my practice. So male fertility also declines with age. Till date, we always used to think about female age. We always used to give about importance to the female age, but now there are a lot of studies which have proven about paternal age as well. Paternal age is also very important. Men above the age of 40 have low fertility rates comparative to men below the age of 40, and especially it's about DNA damage of the sperm is very high in advanced paternal age men. And also there is a high risk of oxidative stress in them. And also men who are having, when there is one good study which has been done on cases of recurrent pregnancy losses where women are having recurrent miscarriages. One interesting fact is that a lot of men are with advanced age. So that means advanced paternal age, apart from reducing fertility, there is also a high risk of recurrent miscarriages in these couples. So lifestyle strongly, as I told you, lifestyle choices strongly impacts your fertility. Infertility is a couple's issue, not just a woman's problem. I'm not going into detail of the common causes of infertility for women. We have tubal blocks, PCOS, endometriosis, advanced maternal age where there are low AMH levels. So these are all some of the common causes, unexplained infertility. Common causes for women when you look at the men, there are low sperm counts, poor motility, lifestyle factors, obesity, diabetes, smoking, all these affecting the male is fertility. When you look at the percentage, 40% they are male causes, 40% are female, 20% are combined and unexplained. That's about fertility. Sexually transmitted diseases. The most common, as I told you, is HPV, which can be prevented. One of the most common cause for cervical cancer. Apart from that, 50% there is a risk of penile cancer as well. Now we are giving HPV vaccination to all women till the age of 45 years. The best period is to vaccinate before entering into your first sexual activity, because before becoming sexually active. But if you are sexually active also, it is effective if you, to take before the age of 45 years. And we are now giving to men also. It is protective against penile cancer as well. The most common sexually transmitted diseases are HPV, chlamydia, gonorrhea, and HIV. Untreated infections can cause infertility. Many sexually transmitted infections are preventable by safe sexual practices. Safe sex saves future. So it's very important to use protection. Get vaccinated against HPV, which I told you. Avoid multiple partners. Get tested whenever you are in doubt. Prevention is always better than treatment. The contraception options we have barrier contraceptives, condoms, we have oral contraceptive pills, we have IUCDs, cooperative devices, injectable contraception. Now we have injectable forms as well. So whatever suits your health and life stage, it's very important to consult a doctor and take a proper contraceptive advice so that you won't land up with infections and also unwanted pregnancies. When it comes to lifestyle, protect your fertility, maintain healthy weight. It's very important. Exercise regularly. Avoiding smoking and alcohol is vital. Managing stress is very important. Everyone is living in a very high stressful environment. Sleeping well is very, very important. When should you see a doctor? Whenever you're unable to conceive after 1 year of unprotected intercourse, if your age of less than 35 years. But if you're more than 35 years, after 6 months of trying with unprotected intercourse, still there is no pregnancy, it's very important to consult the doctor. If you're having irregular periods, severe pelvic pain, known medical conditions, or sexual dysfunctions in males, it is time to see a doctor. Why do sexual myths spread so easily? Why? Because there is a lot of silence around sex. Nobody wants to talk about sex. Sex, the word itself is so stigmatizing. If I say sex, everyone look aside or doesn't want to hear that word. So there is a lot of silence around sex. There is cultural discomfort around it. Internet misinformation. A lot of people doesn't talk to the doctor. They take information from the internet, which gives you which might be not same for you. It may not apply for you. One size doesn't fit for all. So there is a lot of misinformation from the internet, which a lot of people take from lack of structured education about sex. And obviously this silence will lead to shame. The shame leads to delay in approaching the doctor or delay in diagnosis, which ultimately leads to disease per se. As I told you, why this conversation matters: misinformation causes fear, and shame delays medical care, and also about it harms the relationship between the couples, can lead to preventable infertility. As I told you, just managing a sexual dysfunction in a male can achieve a pregnancy, can lead to preventable infertility. So silence breeds myths, science empowers people. So today, let's replace fear with facts, with no embracement, no judgment, but just only science. So the first sexual myth today, or the reproductive and sexual myth today, which I'm going to discuss, is infertility is always the woman's fault. A lot of people think that women are responsible if pregnancy doesn't happen. I'm into the field of fertility for past 15 years. Initial days of my practice, I'm seeing only women coming to fertility clinics and getting treated. But I'm very happy to share that now men do accompany women, and now a lot of men are going for semen analysis testing, which is a very promising move, and it's a very positive move, which I'm seeing in my fertility practice for the past 15 years. When you look at the fact, when you look at the causes of infertility, 40% are female factors, 40% are male factors, in 20% we see combined factors. So infertility is a couple's condition, not a men or a woman problem. When look to myth number two, a lot of people talk to me, a lot of young unmarried men come to me and says that masturbation causes weakness or infertility, or a young married men who had a history of masturbation come to me that he's not able to have proper sex with his wife, and he becomes anxious that will that because I had masturbated quite a lot, is this affecting my potential now? It's most common myth patients come to me with. So yes, the myth is masturbation reduces strength or sperm count. The fact is it's a normal behavior, doesn't cause infertility, does not permanently affect sperm, but mental guilt is more harmful than the act itself. It needs a lot of counseling for that. The myth number three is men are always sexually ready. Lot of people, as I told you, as I'm being into fertility, I tell the people, I tell the couple, I do the follicular study and tell them at the time of ovulation have to have you should have intercourse and all. I tell them timed intercourse, when to have intercourse and all. But the thing is, when after I did this course, when I'm talking with them in detail, then I understood that lot of men are not able to perform during the time of ovulation. That's called situational anejaculation, because they become so anxious that now the woman insists them to have intercourse, as doctor told me that I have ovulated. And some women ask their partners to have sex at least 2 to 3 times during the time of in a day, during the time of ovulation. So it is very taxing for the men, and for the men it is not always about physical act. Mentally relax to have a proper intercourse. So a real man should always perform. It's a myth. Fact is, as I told you, stress to perform, or expectations, all these things will definitely affect the erection of the man. So it's very important to have a calm attitude. And also I tell my patients to have at least have alternate day intercourse, leave about when to have, whether you have ovulated or not, I'll ask them to have normal active sexual life. So it's very important to deal with it. Stress, diabetes, men with diabetes, we have motility issues, erection issues, ejaculation issues. If you're facing it, it's very important to talk with your doctor. Obesity, obese men has erection issues and low performance problems. So it's very important if you're facing with it. It's not generalizing. I'm not generalizing. Sometimes men with weight might have these issues. If you are facing it, it's important to talk with your doctor. And sleep disorders also affect performance. If you don't have proper sleep, you are not active, you don't want to have. So these are all factors which affect the erection of the men. So erectile dysfunction is often medical. So seeking help is maturity. Myth number four: women don't have sexual desire. A lot of people think that women doesn't have sexual desire. It's not true. Desire is mainly man, is something which is a myth which a lot of people think. But no, women do have equal biological desire and needs. Hormones, mental health, and relationship quality influence the libido of the couple. So it's very important to have open communication between the couples. Myth number five: birth control pills cause permanent infertility. A lot of people think that if I use OC pills, might damage my ovaries forever. No, fertility usually returns quickly. Pills can regulate cycles, often beneficial in PCO patients. Myth number six: pregnancy cannot happen the first time. A lot of people think that the first intercourse is safe. It's not. If you are ovulating during the time of your first intercourse, unprotected sex, it can lead to pregnancy. Even one exposure is enough. Myth number 7, only certain people get STDs. STDs happen only to multiple people having multiple partners or something. No, the fact is anyone sexually active is at risk. Many infections are silent. Protection and testing are important. Myth number 8, penis size determines satisfaction. Size equals masculinity, but the fact is emotional intimacy and communication matter far more. Psychological confidence is a key, not the size. Myth number 9, periods are dirty or shameful. Menstruation is impure. But the fact is, it is a healthy biological process. It signals hormonal health. But the severe pain is not normal. If you are in severe pain, then you have to consult the doctor. Myth number 10, sex education encourages early sex. A lot of people or in the parents have an attitude that if you're getting exposed, if you are getting your children exposed to sex education early, either in the school or consulting a doctor, it encourages early sex. But the thing is, the myth is education promotes risky behavior. The fact is, research shows that it delays risky activity because they know what is what, they know about the reproductive organs. It improves, in fact, safety and decision making in men and women. A few slides about nutrition. As I told you, it's about reproductive or sexual health or menstrual health is very important. But the thing is, you have to be taking a balanced diet. Nutrition is very important to have a good quality egg or sperm. So healthy eating is eating a variety of nutritious food from 5 groups on the food plate. Eating well balanced meals with healthy snacks every day and occasional treats is important. Listening to your body, eating when you are hungry, stopping when you are full is very, very important. Healthy eating is not a strict diet plan. Now, a lot of people are doing dieting. There, a lot of people are on keto, intermittent fasting. Now, anti-inflammatory diet has come, Mediterranean diet. There are so many diets available in the market. Today, I have just going through the social media. I have seen a diet by PCOS Ramzan diet, because now Ramzan is the first day of fasting on Ramzan. So I've seen ad Ramzan PCOS diet. So there are a lot of social media gimmicks are happening and a lot of diets they are promoting on the social media. But what I tell you is healthy eating is not a strict diet plan. Healthy eating is not skipping meals. Healthy eating is not avoiding snacks and treats completely. A fat-free diet and low-carb diet is not healthy eating. Extremely high-protein diet is not healthy. About counting calories all the time is also not healthy. What is healthy? Healthy eating is well-balanced meals. Healthy eating is important because healthy diet provides vitamins, minerals, energy your body needs to perform its best. A healthy diet can help lower your risk of disease like diabetes, hypertension, heart diseases, and cancer. We need grains, fruits, vegetables. Grains provide carbohydrates, provide energy for your muscle and brain. Grains give you fiber, iron, and vitamin B. So this is very, very important. But we have to have more fiber and less processed flours. Why do we need fruits and vegetables? We all know fruits and vegetables have vitamins A, C, B, calcium, fiber, and iron. So it's very important to eat fruits and vegetables in your diet. Dairy is also important. It's source of protein, calcium, vitamin D for stronger bones, teeth, and muscle. Protein is the bodybuilding blocks. It's very important to build strong muscles and strong bones. Oils, oil or good fats are also very important. When you look at the good fats, it's olive oil, avocado, nuts, salmon, fish oils. So nuts and flax seeds are good fats, whereas not good so fats are butter, whole milk, fatty meat, ice cream. So avoiding fried food, which is trans fat, such as French fries or donuts, some bakery products. All these things are not good for your health. Maintaining hydration is very, very important. At least having 8 glasses of water every day is important. So keep yourself hydrated. It's very, very important. You should avoid sugary drinks and high energy drinks which contain a lot of sugars. What are healthy snacks? Some healthy snack options are fruits, salads, yogurt, homemade snacks, popcorn, dry fruits. These are some healthy snack alternatives. Remember, it's all about balance. Balance is the key to healthy nutrition. Minimum 3 balanced meals per day. Balance a variety of foods from all the food groups throughout the day. Balance healthy meals and snacks with occasional treats. Balance nutrition with some fun physical activity. Stress management. We all are living in a world where there's a lot of stress from the work, stress from our whatever expectations. We are all living in a world with full of stress, so it is very important to recognize the problem. And it's not stress is not if you are recognizing that you are feeling stressful, it's not an admission of weakness or inability to cope. It's a way to identify the problem and plan measures to overcome it. So mantra ABC strategy: aware, being aware of what is causing you stress, balancing it and controlling it. Stress management: change your thinking, change your behavior, change your lifestyle, and be organized so that you can reduce the stress. Being Having a good laugh is very, very important. Laughter therapy is very important. Good stress reducer applies at home and work, relieves muscle tension, improves breathing, pumps endorphin into the bloodstream, the body's natural painkillers, endorphin. So laugh, laugh, laugh. Always be happy and healthy. So my take-home message for today is: myths create fear. Fear delays care. Delay worsens the outcome. So it's very important to have open conversations, open discussions, ask questions, seek science, protect your health. Thank you so much for your time and attention. Thank you. So, thank you so much, all of you. If you have any doubts or questions, you can type in the chat box. I'm going to answer. Hi, hi, hi. Hello. Yeah. Someone raised hand. Chat. Okay. Yeah, Namika. Hi. Good evening. Do you have any question? You can type in the chat box. Okay. Okay.